Welcome, everybody, to Sostento Live. I am Joe Agoda, your host, CEO, and founder here at Sostento. Now, before we get started, I'd love to see who's here today. So put your name, your organization, your location in the chat. I know we have a lot of our frontline health workers here with us, joining us, as well as many of our partners. Some of you are watching on recording, but if you are here live, you'll have to sign in to your Google account, your YouTube account, and then you can comment. Let us know where you're joining us from, your organization, and your location. This is our third Sostento Live of the year. Our goal is to bring together our network and share uplifting stories and exciting new approaches to increasing access to healthcare. So we've got a great guest lineup today. And I see we've already got John, our communication manager, in the chat. Hey, John, how you doing? So everybody, please, as you hear me, let me know who's here, where you're joining us from. We're so excited to have you here today. I see folks joining us. We got Deb. Hi, Deb, from the Ohio Association of Free Clinics. Good to see you, Deb. Michelle Taylor from the Virginia Association of Free and Charitable Clinics. We got our state level partners showing up. How are you all doing? Hi, Susan, the Urban Clinic of Atlanta. Great to see you here today, Susan. Lots of folks coming in here. This is a new folks. Hey, Dennis, Jackson Urban League, Center for Advocacy and Social Justice. Welcome, Dennis. New to the stream. It's good to see you. We got Rachel Helton, one of our longtime partners, based in Asheville. Used to work for the Health Wagon. Let's see who else. Friends in Need. Hey, Tracy, Friends in Need, Kingsport, Tennessee. We got a few Tennessee clinics in here. I see Heather. Hey, Heather from the Good Samaritan Health Center in Atlanta. Laquat from the Ibn Sina Foundation, a really awesome free and charitable clinic, was a guest last time in Houston, Texas. One of our supporters. Hi, Melanie from the Amerisource Bergen Foundation. We got people coming in from all over. The Space Coast. Volunteers in Medicine on the Space Coast. Hey, Lee, how you doing? All right, got a lot of folks coming in. Welcome, everybody. Please keep letting us know you're here in the chat. But I want to get us started. So today, we're talking about an often overlooked challenge that creates barriers to life-saving healthcare, and that is transportation. To talk about this issue, I'm going to bring us back to early 2021. That may feel like a distant memory, but in the first months of 2021, the hardest reservation to get was for your COVID vaccine. The vaccine had just been approved, and millions of people were lining up to get their vaccination. By the time we got to the late spring and early summer of 2021, vaccine appointments were easier to find. Mass vaccine sites were popping up across the country. And we were implementing the most ambitious vaccination campaign this country had ever seen. By the time we got to that early summer phase when appointments were more available and vaccines seemed to be around every corner, it seemed reasonable to think anyone who wants a vaccine can get one. But our free and charitable clinics that we worked with were telling us that was not entirely true. Vaccination sites were not accessible to all, both in physical location and distance to arrive at a vaccine site, but also the time that those vaccine sites were open and the ability for people to get there conveniently around their work schedule. These vaccines were accessible for most, but not for everyone. And that was especially true for many of the patients served by our free and charitable clinics. These were essential workers, under and uninsured individuals who were having a hard time reaching the vaccination sites, and transportation was the barrier. The fact is that poor public transportation and limited access to personal transportation ultimately discourages individuals to get the healthcare that they need. That means making it to their appointment and seeking medical attention and the care that they really require. Transportation challenges based on studies like this one, supported by the Robert Wood Johnson Foundation, found that these challenges made it likely for people to miss or delay healthcare appointments because of transportation barriers, which in turn increased the cost of their healthcare and contributed to poorer overall health outcomes. The fact is, transportation plays a critical role in a person's access to healthcare services and greatly impacts their overall health outcomes. This is particularly true at the safety net level, where lack of transportation creates a major health equity issue. And that showed up in vaccine access during the summer of 2021. Now, Sostento was considering, what can we do about this? How can we help our clinics mitigate the transportation challenge for vaccine access? That's when we were introduced to a brand new initiative from our network partner called the Vaccine Access Fund. The Vaccine Access Fund was a collaboration between Uber, PayPal, Walgreens, and a nonprofit called LISC. This initiative was offering free transportation to individuals to vaccine appointments with an Uber ride. So we jumped up the opportunity to see, could this work for our clinics? Was not as easy as it first seemed. Many of the individuals that were trying to reach the vaccine appointments had never used Uber before. They did not have the app. They had never used rideshare technology. So there were technology barriers. As well, you needed a credit card to open up an Uber app. Many of these patients did not have a credit card. And so the individuals could not use the Uber app itself to get to their vaccine appointment. The Uber Health platform helped us overcome this first challenge. We're going to learn more about this platform in a little bit, but what this allowed us to do is have clinic staff and volunteers order a ride for an individual to reach the clinic for their vaccine appointment. The individual never needed to download the app. They didn't need to open the app. They called their clinic. They needed transportation to get their vaccine appointment. And then the health worker at their computer could order that ride for them. And the next thing that individual knew, a ride would show up at their door, a text message saying your ride to the clinic is here. And they could get to their vaccine appointment. This, we found, though, was still not enough. Clinic workers needed to be trained to use the Uber Health platform. Some clinics actually didn't have a credit card themselves to open up an Uber Health account. The first-time riders needed special support, education to understand, what is this rideshare thing? Who is driving this car to picking me up? We would often hear, where's the taxi sign? I don't understand. What is going on? Should I trust this? And this is when Sostento got to work designing a service that took on the trust building, administrative requirements, and technology training needed to get the service operating. By the fall of 2021, rides started going out from a number of our clinics that we brought onto the service. We had completed a few hundred rides for vaccine access. Then, in a few weeks, we were into the thousands. Stories were coming in from across 6 states and 15 clinics that were using the service. One story from Helping Hands Clinic in Jackson, Tennessee, landed on the local news. They were using rides to get to not only to get their patients to the clinic, but they were taking their staff in a mobile vaccine cooler in an Uber to get out into the community and to do vaccinations. Here's that news story, local ABC News, covering that innovative approach to using the Uber rides, not only to get patients to the clinic, but a health worker, a mobile vaccine, mobile cooler. I got to go to the clinic and see it. They would send them out in Uber and do a home-based vaccination or community-based vaccination. More stories from Montgomery, Alabama, Medical Outreach Ministries, where they have a serious historic transportation issue. The rides took off purely through word of mouth, and that clinic has done thousands of rides in Montgomery, Alabama. No marketing dollars, strictly by people telling each other, hey, get a ride, get your vaccine. In McAllen, Texas, Il Milagro Clinic, they would send staff out into the community. They would be meeting people. McAllen, Texas, right on the border with Mexico. They would meet people where they were, educate them about the vaccine. When they said, hey, I want a vaccination, they said, you got it. And they would order an Uber for them on the spot to take them from the community to the clinic to get vaccinated and back. In one of our clinics here today, Ethne Health in Atlanta, told me a story of how they used the rides to transport newly immigrated families from Afghanistan to their clinic to get vaccinated. But what they found was those individuals did not speak English and they needed a translator. And they used an Uber to bring a translator from their local dialect across town to the clinic to educate them, to make sure they knew what was going on, and then to vaccinate them. These stories, there's so many of them. I can't spend all the time telling you all of them, but there are so many inspiring stories from our network around these rides. And today I am proud to announce that in June of this year, 2023, Sostento passed 10,000 total rides delivered. It's an amazing number, 10,000 rides for individuals to reach vaccine services, to get vaccine education. And today we are officially ending our free vaccine ride service, but the rides are not stopping. We are continuing our rides in a new phase to use these rides and this approach that we have discovered for other health access needs. And we have ambitions to bring this to other communities across the country. So you see here, we did not do this alone with our clinics. We had a number of partners to get to that 10,000 numbers. And I want to shout them out too before we get going with our guests. Uber Health and Lisk were our starting partners to get this going. And we'll hear from them a little bit later. None of this would have been possible without them helping us get the platform going, making sure we had the funding we needed to cover these rides. And so thank you, Uber and Lisk, for all of that. CDC Foundation also supported the complimentary education, events, and marketing we did do to get the word out about the rides in some locations. And so thank you to the CDC Foundation as well for supporting our initiative. And now as we look ahead to how we can take these vaccine rides and translate them into health access rides for other health equity needs, I'm proud to share that 2 new supporters have stepped up. The W.K. Kellogg Foundation will be supporting us to expand rides in the state of Mississippi. And the AmerisourceBergen Foundation will be supporting our staff into 2024 as we transition from these free vaccine rides to our Uber health equity rides. Now, our goal by the end of the year is to double the number of clinics that are using this free ride service and develop a way to sustainably bring this to more free and charitable clinics across the country. It will take many groups, the clinics and new partners, old partners, big and small, to make this possible. And I know what we can do when we come together and we take on a challenge like this. Things that we thought were impossible, were problems that were deeply rooted and intractable, we can solve them. So let's start talking with some of these partners that are going to make this possible. I want to tell you about my first 2 guests I'm going to bring on in just a moment. We are going to have a representative from Uber, Laura Aldred, who's the manager of partnerships and business development at Uber, a good friend of Sostento who has helped us along the way. We will also have the director of health initiatives at Lisk, Erin Kelly. So we'll be talking to them a little bit more about this initiative, how it got started, what we've been learning. So let's not delay. Let's bring on Laura. All right, welcome. Hi, Erin. Hi, Laura. How are you?
Great. Happy to be here today, Joe.
Hi, Joe. Doing well. Thank you.
Excellent. Well, you 2 are part of the genesis story for Sostento, so we had to start with you 2, and we're hoping to learn a little bit more about the service, how it came to be, what more can we expect from it in the future. So I'm going to start with an introductory question first for you, Laura, and then for you, Erin. So Laura, first, I think a lot of people have heard about Uber. They've taken an Uber for getting their own personal transportation. They know about the concept of rideshare, but I think less people know about Uber Health. So maybe you can start grounding us, telling us a little bit about the Uber Health service and what are the basics that we need to know about it.
Yeah, absolutely. And so first off, thank you, Joe and Sostento team, for having us here. And Erin, it's great to be alongside you live here, knowing all the work that's gone into our partnership. And so for folks that might be newer to the conversation, I've actually seen a few of the end users join here. But folks that are newer, Uber Health is a subsidiary of Uber. So you all may know Uber as an app in your pocket that really allows you all call on-demand rides and get to where you need to go. Uber Health's original mission was to bring access to a new subset of riders that may not have access and may not be riders on our consumer app today. our goal was really to think about who are the users that might not want to, say, have a credit card, might not be able to sign up, and think about an experience that was really designed for healthcare. So what Uber Health built was a web-based dashboard tool that's HIPAA enabled that allows those that work with, say, patient populations, community populations, to be able to call and request Uber rides on behalf of those individuals. Reduces the burden so that way folks don't have to think about their own self-navigation. They don't have to think about signing up for an app that they may have never used before, or if they don't even have a smartphone or access to that type of technology at all, reduces those barriers that so that those individuals can have access to both on-demand rides as well as scheduled rides to get where they need to go, whether that be medical appointments, whether that be to the pharmacy, or whether that be to a food bank or other types of non-medical sites of care. Today, Uber Health supports over 3,000 different types of partners and customers. We work across providers, health systems, increasingly health insurance partners, as well as really critical nonprofit and community-based organizations. Uber Health scope is expanding a bit. Since our foundation in 2018, we're really thinking about the ways that we can bring access to the independent contractors that operate on our platform as drivers or courier partners and bring forth new services. You may see some recent announcements from our team as we think about complementary offerings alongside transportation, whether that be prescription delivery of OTC products, as well as groceries. So really excited to be on this conversation today to talk about some of the flexible and adaptable ways that communities have worked with Sostento to implement our platform.
Thanks, Laura. The thing that you said that resonates with me was what we try to do every day is to reduce the burden. Reduce the burden on not only the patient, which is definitely one of our key objectives, but to reduce the burden on the health worker. And I can't tell you how many of our health workers have said when someone is not late for their appointment, when someone is able to come in, schedule ahead, that reduces the burden on them. So I just wanted to shout out that reducing burden is a huge part, definitely that I've also seen for the individuals as well as the health workers.
And represents such an opportunity to be proactive in healthcare, I think. The ability to actually maybe potentially catch a no-show early, to be able to call a patient, have a conversation. And so really think not only reducing those access points, but giving some data and insights to clinics that they might not traditionally have access to.
Absolutely. Thank you, Laura. So now, Aaron, I want to go over to you because you kind of brought these big corporates together, your organization, LISC. You helped connect that with community partners that could really get these rides to the people that they needed them. So maybe you can tell a little bit about yourself, about LISC, and about how this Vaccine Access Fund originally came together.
Sure, and I'd like to echo Laura's thanks. It's great to be here with you, Joe, today, and all of your partners out in the community, and also with Laura. We are so delighted to be working with the Uber Health team. I'll talk about that a little bit more in the conversation. But yeah, so LISC is Local Initiative Support Corporation. We've been around since 1979. We're a national nonprofit that, among other things, we're a community development financial institution. So we're also a lender, but we also do many more things than that, including programs like the Health Access Fund, bringing resources to communities that we care about and that everyone on the live stream today cares about. Communities that have been overlooked historically and disinvested, and bringing resources to bear to ultimately improve health outcomes and foster health, improved health equity. So for the Health Access Fund in particular, Uber actually came to LISC about the original iteration of the program, the Vaccine Access Fund, which you did such a great job at the top of the call, Joe, describing. And so they brought PayPal and Walgreens with them. They made it really easy for us. So LISC had a prior relationship with Uber around support to small businesses. And so we at LISC understood their charitable interests, and they had experience with our local partner network across the country. And we both knew that would be key to the rideshare program. LISC has boots on the ground in 40 urban markets across the country, ranging in size from Duluth, Minnesota to New York City. And we also have a network of rural partners in many rural counties across the country. So that local partner network really would come to bear in a very positive way for the success of the rideshare program. And so from there, once we got launched, our goals really for funder stewardship were centered on making sure that we were accurately sharing intel from our community partners about what they needed. And that was truly like in real time as the landscape changed so rapidly. And I know everybody here today knows better than anyone how quickly that landscape was changing. And so then we worked with the funders to respond to those needs while addressing their interests around the use of very significant dollars and also the driver network they were bringing to the table. And so Uber proved to be just like an absolutely extraordinary partner. So the job of bringing the funds to bear was actually relatively easy in this case.
Yeah, Aaron, one follow up for there. I think that whole COVID response taught us is the need to be agile, the need to be able to kind of go as the context changed. And that's something I saw that LISC did very well. As you kind of mentioned, it's gone from the Vaccine Access Fund to the Health Access Fund. Anything you would share about staying agile with such large partners and so many different organizations? Obviously, you have the kind of bench to do it over there at LISC, but anything you would want to share about how you were able to really kind of keep shifting as the context of the COVID response also changed?
Yeah, I think, so much of that is dependent on really strong partnerships and collaboration. So, like I said, we relied a lot on the intel from our partners in the community. And I think that ultimately drived the success of the original Vaccine Access Fund and allowed us to pivot to the Health Access Fund. So each of the parties that was involved in that case provided their own expertise that allowed us to be nimble and really respond to the needs in the community. Um, I'd be delighted to talk a little bit more about each of those partners too and what they brought to the table. And it's one of those things where the sum is greater than each of the parts themselves. We really relied on that partnership, not only with Uber Health, but also with obviously all of our grantee partners, their nonprofit social service providers in the community, and also obviously our funding partners.
Absolutely. So, Laura, why don't you talk also about partnership? Partnership and collaboration was key to making this fund and the rise of success. So, from Uber's perspective, tell me what partnership and collaboration, like what did that mean to you all, and how did you see the success come from what we did together?
Yeah, no, I think that's a great question. And I think for us at Uber Health, as we think about not only what we do from a platform standpoint and think about the technology that we design, when we think about how that technology actually gets implemented and what that looks like within a community, proximity to patients matters. And thinking about how that experience might look different for different patient populations. We know from data and research that not only does an individual zip code matter, their street matters, but there's even differences between household. And that's where I really think the value of what Sostento has done, alongside LISC and the curation of networks of nonprofits, free and charitable clinics, folks that actually sit within communities and know their members that are walking in and out of their front door each day. And I think a huge value of this partnership has been having that local nuance to be able to be nimble and flexible and think about the new ways and the new use cases that our platform can unlock. And so I think a piece of that partnership angle has been extremely critical, not only for how we've been able to look back and evaluate the evolution of the Vaccine Access Fund, but also as we look forward to the Health Equity Fund and how we've been able to think about what does expansion of use case mean and what can that impact really look like. I think the second piece of partnership that I think is really critical, and Aaron, I think you touched on it in kind of the origination of this Vaccine Access Fund. And a big part of that was through the partnership that Uber Health was able to develop with LISC, not only through generosity of corporate funders alongside Walgreens and PayPal, but then looking at how do we actually think about effectively deploying that capital? And that's where a partnership with LISC was really critical for Uber as a whole. To think about how can we find a partner that not only has the experience at a local level within communities to think about what is appropriate, how do we identify the right organizations to be able to operationalize these types of program and really ensure that we're driving the most value out of those dollars. And we've been super excited for what LISC has been able to do as being a third-party independent partner to be able to evaluate how to do this at scale. And so super grateful for what LISC has been able to teach our organization and thinking about kind of the appropriate administration. Mm-hmm. I do want to have one third call out, and Joe, we can touch on this more. I think the third piece of this has really been as well the work through Sostento Joe, I think you did it. You said it very eloquently in talking about provider burnout. We've seen it across the healthcare ecosystem throughout the COVID-19 pandemic, and even the wind down from the public health emergency, especially as we look to things like Medicaid redeterminations. Provider burnout is pervasive. And so the way that Sostento has been able to step in as an operational and administrative partner to be able to bring better scale to these types of programs, when providers know when someone's not able to get to and from an appointment, when they're pushing out an appointment for weeks on end, and having not only the technology partner, but also having that partner that can support them alongside of that, I think has been really kind of the secret sauce as we've talked to some of the community clinics that are on the phone here and heard from other partners about how they've really been able to incorporate transportation scalably and sustainably into their clinic operations.
Yeah, Laura, I mean, that really strikes my heart. Speaking about the health workers who are central to our mission. And what we found with these rides is that it allows them to do things they never thought possible. And once you give them the training, the skills, they take it in ways you would have never imagined. You talked about that local nuance. And that's something we saw as different clinics said, hey, can we use it for this? Can we use it for that? And what was great, we would go back to listing and say, hey, is this okay? Can we send staff out in rides to do home-based vaccinations? They said, you go for it. They said, hey, can we do on-demand rides? Can we do flexible rides? They said, yes, you can do it. And that's where I think collaboration and network comes in very important, was that when we learned something from one clinic, we didn't say, oh, that's great. We went to all the other clinics. We said, hey, you can do it this way as well. And so I think that's where the collaboration, the knowledge sharing also becomes really, really important. But I'm glad you called out the health worker, the burnout, the burden, anything we can do to lift that, is going to help so many members of the community. So I appreciate you calling that out, Laura. But let's go back to you, Aaron. I have a question. Maybe talk a little bit more about the collaboration, and we're going to Aaron. And Aaron, I want you to talk a little bit more about collaboration, and also how you're transitioning from this transition you're doing from the Vaccine Access Fund to the Health Access Fund, which is now done. So talk a little bit about that transition and the different community partners that are now doing rides, not just Sostento, right? We're one of many in your cohort. So talk a little bit about the transition, the different partners on the ground that are doing rides, and maybe what you're learning from them.
Absolutely. No, thanks, Joe. I wanted to piggyback on a few things that Laura said, because I think we have a mutual admiration society between LISC and Uber Health. I'd be remiss to not mention just all the great feedback we've gotten from our many partners about the Uber Health team, how responsive they are, how just great partners they are from a customer service standpoint. And so just wanted to give you all a shout out too, and appreciate your partnership and really getting this to scale. I mean, here we are celebrating the 10,000th ride of Sostento, and think of that across all of the partners that we've been working with, not only with the Vax Fund, but also, as Joe mentioned, our transition to the Health Access Fund. I also wanted to just mention the other partners that that make this collaboration and make this effort so successful is also not those that are just part of the Health Access Fund, but also members of the other community-based organizations out in the communities where our partners are working. Because, and this is a good transition to the Health Access Fund, we've now transitioned just from vaccine access to driving health equity through addressing social drivers or social determinants of health. And Laura touched on this a little bit already. So, we all know, many people on the phone, I'm sure, in the healthcare sector, that really health outcomes are driven not only by healthcare access, but actually more so by those social drivers of health. And so the recognition of being able to transition to addressing social drivers of health through these rides with Uber Health really is a testament to our partners, our funding partners at Uber, PayPal, and Walgreens, who gave us a thumbs up in transitioning to the Health Access Fund. So the real difference here is that now the rides can be used not only for access of healthcare, but also to appointments that are related to, or not even just appointments, but access points for things that are related to social determinants of health or social drivers of health. So that might include, as Laura mentioned, a ride to a food access point to get healthy food, to a pharmacy, to which, of course, that's also health related, but even to job training, to provide someone an opportunity to get the skills they need to perhaps get a higher paying job, a higher quality job that helps improve not only their quality of life, but ultimately health outcomes. That's further the research around that. Obviously, that's a bigger lift, but So that's really what we pivoted to with the Health Access Fund. And again, I just wanted in that collaboration as well, I wanted to just mention our funding partners. I know you mentioned, both of you have mentioned earlier, it's both Uber and Walgreens, and I had mentioned that Uber brought Walgreens and PayPal to the table. Those dollars are not only paying for the rides, but also the critical overhead that I know, Joe, that you referenced earlier. Not only the ride coordinators, but it's that human touch that can really be the game changer for especially someone who may be taking a ride for the first time. And so that's very different than just handing someone a voucher and saying, here, go figure this out. Having that empathic human touch, especially out the gate for someone who may not have that prior experience, proved to be really critical. And we've heard that from many of our partners. So it's both that staff time for the critical ride booking, but also the follow through on making sure the ride is happening. I wanted to just say a couple other things about the transition to the Health Access Fund. So Joe, you had mentioned we are working with more than 20 community-based organizations across the country, including healthcare organizations. And that's focused in 3 categories. So it's both organizations that are providing access to healthcare services via Rides with Uber, but like I said, also those that are providing access to services and activities that address social determinants of health via Rides with Uber Health. And if I could just mention one, we're working with a partner in Northern Indiana that contacted us. To your point, Joe, it's like, oh, is this an eligible ride? And we tried to be as clear about that up front, but sometimes it's hard to anticipate everything. But in this particular case, it was an older adult who was socially isolated. And they said, can we give him an Uber ride to get to the YMCA so that he can have some socialization? And we said, absolutely. We all know that social isolation is a big health problem as well. And so the flexibility that pivoting to the Health Access Fund has allowed is really, we hear from the field, just providing opportunities for health equity in ways that we didn't even imagine out the gate. One other thing I just wanted to mention is our partners across the board are really focusing on 5 major health categories or target areas. So we're looking at improving maternal health, managing chronic disease, supporting access to gender affirming care, supporting older adults, like I mentioned, and also reducing food insecurity. So those are sort of our bullseyes, but of course, everybody is doing even more than that.
Thank you, Aaron. First of all, thank you for shouting out the people that make this possible, the staffs. The Sostento team is here. They do training, they do troubleshooting, they do programmatic support. They don't always get the limelight, but you all Sostento staff out there showing you some love. And I want to add one other thing, Aaron, that you've added for this new Health Access Fund that we are working hard on, which is to collect data about what we're doing. We're collecting new data about who's benefiting from the rides, what types of rides are they taking, because there's not enough data out there about how these rides help people. So we're going to be collecting some really, really great data as well through this next phase. So thank you, Aaron. So we're actually coming to the end here. So Laura, you're going to get the last question. Help us look out into the future a little bit. Tell me, what should we know about Uber Health? Where are you going in the future? How do you think these rides may evolve as we continue in this post-COVID emergency landscape?
Yeah, I love that question, Joe, and I'll keep it short just so we can get to our next really great panelists. I think a few things. I've alluded to some of the work that Uber's Health is doing to become more bidirectional, thinking about not only the movement of patients and community members, but also thinking about how can we bring services to them. And I think you touched on some of that creativity that happened organically in programs, thinking about the movement of staff. I think one of the things that myself personally, and I think I can speak on behalf of the Uber Health team, that we're really excited for is how these local community organizations can really begin to meet their members where they are and begin to drive unique value and use cases that may not even be apparent to our teams. And so we touched on aspects of incorporating rides to get to social services, other types of community-based referrals, thinking about access to food banks, but also thinking about some of the unique nuggets that we've heard from other partners and programs, such as a maternity project, where through incorporation of rideshare, that individual got to bring on board her family with her, had a private vehicle experience, as opposed to what she was traditionally doing, taking public transport. And so I think an aspect to touch on that earlier question on collaboration is really this forum for being able to share these stories. So that way we can really make sure that we can share these use cases out so that way they can be adapted and even think about nuance within your communities. And so super excited to be able to continue this collaboration here, to be able to drive forth these types of conversations. And then to your last point, Joe, I think data is a really critical component of this. As we look out into the future, we all want to be in a place where there's sustainability and funding sources for these types of programs. And data is a huge component of that. And so where our team gets really excited is thinking about these types of partners that prove out ROI, have the patient anecdote stories, and can really build out that case and think about future opportunities for funding sources, such as reimbursement through health insurance, other types of grants and programs. And so super excited to keep this collaboration going and center it around data to drive forth the sustainability in the future.
That's a good note to build on. There will be more evidence, more stories, more data to come. Thank you, Erin. Thank you, Laura, for coming to talk about the work that you've been doing with Sostento to increase access to healthcare with these rides. It's so innovative. It's a game changer. Thank you for setting up a little bit about how it all came together and how it's worked with the audience. So thank you all. Take care.
Thanks for having us.
All right. Well, we're going to do a little gratitude break here, but let's see. I just want to quick shout out a few more people we have. Hi, Angie, West Virginia Health Ride. Good to see you. Brooke from Wellness and Stress in Memphis, Tennessee. That's one of our ride clinics. Hey, Brooke, how you doing? Donna, another state partner here from the Georgia Charitable Care Network. Another West Virginia representative, Laura from Milan Pusker. How you doing, Laura? Medical Outreach Ministries. Hi, Henry, our #1 rides clinic. Got to shout you out, doing more rides than any other clinic in our network. Amazing, amazing work. So thank you, everyone, for joining us. What we're going to do now is take a quick gratitude intermission. And for that, I want to bring on Sostento's Director of Partnerships, Emily Roning. So let's bring on Emily.
Hi, everybody.
Hi, Emily. How you doing? I'm going to let you take the floor and give a little gratitude intermission before we get to our clinics. So stick around after we get to our clinics. But Emily, please take the stage.
Yeah, thanks, Joe. Hi, everybody. If you tuned in last Sostento Live, you kind of know what's coming. We loved taking about 3 to 5 minutes last time to put something that we're grateful for in the chat. As we all know, Sostento's kind of true meaning is to sustain, uplift, and nourish. And so on theme, we are going to run this exercise again. And I'll start. So I'm really grateful for actually an internal staff here at Sostento. And so while you guys put your comments in the chat, I want to bring on a staff that's been with us for about a year. Her name is Ritika Chanda. Many of you have interfaced with her. She's been a part of our kind of newly minted fellowship model here at Sostento. We've been running a 1-year fellowship for about 2 years now. So she was part of the second class of fellows that came to Sostento. And this fellowship is really built around pre-med students who are finishing their undergrad, who are in that gap year as they apply to medical school. So Ritika came in about a year ago this time as she was finishing her undergrad. And now she's at the tail end of a year of doing so much work with Sostento. She's leaving for Georgetown University's medical school in just a few weeks. And Ritika met Sostento through volunteering at an Atlanta-based free and charitable clinic that many of you know, longtime network clinic of Sostento, Good Samaritan, one of Sostento's shining clinics in the network. And during COVID, she really helped operate the Helpline SOS service. So she was a huge part of one of the earliest interventions that Sostento ever built. And so that's how we met her. So great. We're really grateful for Ritika. So here she is to give you just a brief overview of what she's done in the last year. She has worked mostly with the program team, directly with clinics. She's helped with subawards and the HRSA funding, the data collection, the whole sort of HRSA universe. She's been a total powerhouse in getting us organized, kind of on the back end and internally on a new CRM platform called HubSpot, just kind of a really technical platform that she's helped organize and create processes around to keep our team running efficiently. And lastly, Ritika, you have been the behind the scenes sort of workhorse of these Sostento lives. So when it comes to invite lists, writing agendas, making sure speakers are prepared. We really couldn't have pulled these events off without you. So Ritika, now that you're almost done with your fellowship here at Sostento and you're on the launch pad to your next part of your journey, what's something that you're most grateful for from your time with Sostento, if you had to pick something?
Of course, Emily. First of all, thank you so much for those kind words. Like, I'm already kind of tearing up a little. But like growing up, I've always wanted to become a physician, but it wasn't until I moved away to college that I realized how tough it is for a lot of people to get healthcare. Access to healthcare is not easy. So during my time at the Good Samaritan, I learned about the social determinants of health, and quickly became passionate about health equity. And I'm sharing this with you today because something I'm most grateful for here at Sostento and my time at Sostento is for you guys, for giving me the opportunity to learn more about the interplay between public health and medicine, and being able to see firsthand how improving health equity is truly a group effort. So, my time here at Sostento has significantly deepened my passion for improving healthcare access, and I couldn't thank you guys more for allowing me to explore in that realm before heading off to med school.
I love it. I remember, Ritika, way back when I first met you, you said something really similar. So it's pretty inspiring to know that your focus and your drive for equity in healthcare, public healthcare specifically, has not wavered. And we're going to miss you so much. And so I'm so glad we get to sort of send you off live. So let's turn to the chat and see what folks are thankful for. Melissa is thankful for Sostento. Right back at you. Talis, I'm grateful for the ability to work alongside amazing coworkers at CHN. Shout out to Ohio, who have been great mentors for her as an intern. That's amazing, Talis. Excited to chat with you next week. Laura is grateful for her team at Milan Puskar Health, of course, another amazing clinic in the network, full of amazing people, it sounds like. John, our colleague here at Sostento, he's grateful for the health workers who devote so much of themselves to their patients. Amen. We would not be doing this work without all of you. So thanks for taking a moment. 3 cheers for Ritika as she embarks on this new journey in Georgetown. It's going to be incredible. We know that the world of public health is going to be so excited to have you, Ritika. We're so excited to watch you shine. So we encourage all of you to take a moment today to tell someone or focus on something that makes you so grateful. So thanks, everybody. Back to you, Joe.
Thanks, Emily. Thanks, Ritika, for the joining in a little bit of the love fest today. I like the vibe. So thank you both. Let's keep it moving, though, because we got our last piece of the show today. My favorite is going to be our clinic roundtable. We are going to be bringing on 2 frontline health workers that have been delivering rides over the last year and a half with us. We're going to have Yolanda Tolston-Evans from St. Vincent de Paul Charitable Pharmacy in Wisconsin. We're going to have Rachel Jennings from Ethany Health in Georgia. They have both been doing rides. They're going to share about their experience, what they've been learning, how they've been doing it. Let's not wait. Let's bring on Yolanda and Rachel. Hi, Rachel. Hi, Yolanda.
Hey, Joe.
How you doing? Welcome, Yolanda. How you doing?
Doing well. Oops.
All right. Well, thank you both for taking a little bit of time out of your busy day in the clinic to talk with us today. So we'll start with just brief introductions. Rachel, I'll go to you first, and I'll go to you, Yolanda. Rachel, tell me a little bit about your clinic and your role at the clinic.
Yeah, absolutely. So I work at Ethany Health, which is in Clarkston, Georgia, which is right outside of Atlanta. Clarkston is the most diverse square mile in the United States, and our patient population speaks over 30 different languages. So it creates for a very interesting day today. I am currently part of our referrals team and working as a preventative cancer screening specialist. But I started at Ethany as the programmer for our and scheduler for our COVID vaccines. So that's how I really got plugged in with Sostento and with Uber Health.
Thanks, Rachel. It was nice to meet you too. And I went on the road show. I remember we got to talk and see you in action there live. Yolanda, always bringing the energy. Yolanda, how are you doing? Tell us about your organization, where you're joining us from today.
Hello, I'm delighted to be here. I also have Amber behind me here. She's one of our Vista workers, but we are coming from St. Vincent de Paul Charitable Pharmacy. We're here in Madison, Wisconsin. And I would say about a third of our patients speak Spanish, but we also have patients that speak Arabic and Hmong. We have a large Hmong patient population as well. So they keep us on our toes, and we are the only standalone charitable pharmacy in the state of Wisconsin. So we're not affiliated with any clinic or institution, and we take care of folks that are within the Dane County area. So good to be here.
Hey, thanks, Yolanda. All right, so let's get right into it. Let's talk a little bit about the rides, how they've been deployed at your organization, what impact that they've made. So Rachel, tell us a little bit about how the Uber rides experience has been for you. Bring us back to the start, getting it going, what it's been like over the last months as you've been deploying those rides.
Yeah, absolutely. So we first started using the Uber Health rides right at the beginning of doing our COVID vaccines. We were looking for a nurse to do all of our injections, and we were looking around and hospitals were busy. We just couldn't find enough volunteers, and we finally found an absolutely amazing volunteer nurse who's from Ethiopia, and her name is Messi. Shout out to Messi, she's amazing. And the only problem was she didn't have reliable transportation, and we really needed her at the clinic. And she speaks Amharic, which is a language that we don't regularly have staff members speaking in our clinic. So she was a vital part of our COVID vaccine operation. And so when we learned about the Uber Health program through Sostento, we decided this is something we really need to jump in on. And so that was just an absolute blessing for our clinic to have her to have reliable transportation that she wasn't having to pay for. And just making sure she was here and giving our injections every day that we needed her. So that was really how we got started. And then we kind of then shifted a little bit, and then we're able to implement it with our patients as well. So making sure our patients were getting to their injections. Many of our patients are within walking distance of our clinic, but there are many of our patients who don't have access to transportation and are not in walking distance. And so really being able to implement that within just our patient population as well has been really awesome.
Wait, quickly, Rachel, let me get this right. So when you got started, you needed someone to actually give the vaccinations, and that person didn't have the transportation. So you had a volunteer nurse who kind of was your key to get vaccinations going. And I remember that this person, I think, has taken multiple rides, right? Not just once, but was coming in routinely using those Uber rides to get on time and provide those vaccinations. Is that right?
Yeah, that's correct. So once we decided that she was going to be our main nurse for our injections, she was taking probably upwards of 10 rides a week, getting back and forth to the clinic and back to her house.
Amazing. Thank you for that story, Rachel. I want to hear more in a little bit. But Yolanda, let me go over to you. Tell me a little bit about how the rides got started for your organization and what it's been like implementing them over the last few months.
Okay, well, we actually also got started really very early on in the program. We were really excited that this was a new offering that we could offer our patients because although we're in Madison and there is public transportation in Madison, our surrounding cities that are within the county don't have reliable transportation. So being able to offer folks a ride into our pharmacy was really was really key to getting more folks in to both have conversations and also to administer the vaccines. In addition to that, we also do rely a lot on volunteers. So we have a lot of college students too, and sometimes the transportation, they don't have transportation. So being able to get volunteers that could come in, particularly the ones that spoke other languages, in particular Spanish for us, so it's very helpful. So it was just a win all the way around for us.
It's amazing. And Yolanda, I mean, what was your experience like with your staff? I know you've done, not a huge volume of rides, but you've been doing rides. So tell me, do you order the rides? Like, how does it, give someone an idea who've never done this before at an organization, how does it work, tangibly on your end? Like someone calls, they need a ride, walk me through it a little bit.
Yeah, so we have a couple of different cases. So we have some folks that we know always have difficulty getting here. So we offer them rides. We call them and ask them if they need a ride to come. And oftentimes they do take us up on that. And then there are some folks that once they're here, they may have gotten here, but their ride can't wait. And so being able to offer a ride home has been very beneficial. for our patients. In terms of coordinating the rides, I have Amber here behind me here. We've been fortunate enough to have AmeriCorps Vista workers, and so she, along with our previous Vista, they really have been our coordinators of the ride. So we really just tell them, hey, we need a ride for this patient, and so we get their address and their phone number, and they set everything up, and we let them know, what vehicle to look for, what the license plate is, so that folks know who to expect. We have had times where we've tried to say, like the patient may speak Spanish, and we've requested maybe a driver that may be able to speak a particular language. That has been one of the challenges that we've had, because oftentimes that's not available to us. So we do have ways of working around that, but that's been one of our barriers that we have had to work around.
Yeah, that's I like the interesting thing of the one-way ride. So one of the things that I've learned from talking to the different clinics is that individuals are most likely to get a screening, vaccination, preventative care if it's convenient to them, right? So it sounded like even someone could get a ride dropped off at the clinic, but they couldn't stick around. And if you can't get home, that's discouraging. But it sounded like even there were some cases where an individual would get to your clinic, be able to, get their appointment, get their vaccination, not worry about how they get home. You would just actually send them with the ride home.
Exactly. Yes.
And
we also
go ahead.
I was going to say, we actually have a food pantry as well. So folks were able to not only get their vaccination, or we were able to talk to them about getting vaccinated. Some folks had to think about it, and we encouraged them to talk with their family members, and that we would bring them back when and if they change their mind, but also being able to offer them a ride with their food, because maybe folks are riding on the bus and carrying, multiple bags or boxes of food was very difficult. So being able to offer them, a ride to and from where they lived was also a key selling point.
Well, I love how you spoke about how the ride opened up new opportunities beyond vaccination. They were at your clinic. They could get to the food bank, and they could carry more food home if they had that ride home. That's really uplifting and inspiring to hear about. And also shout out to the AmeriCorps Vistas ordering those rides, because we know that one of the keys to success is the first time. Yeah, there we go, raise the roof. That individuals who it's their first time doing a ride share, I've heard that the coordinator will be on the phone with them saying, yes, it's a red car. This is the license plate. No, don't worry. There's no taxi sign. That's okay. You can get into the car with them and even stay on the phone with them the entire first ride. And what we've heard is that once an individual takes one ride, they're like, okay, I can do this. And then they're able to do multiple additional rides, tell their family and friends about the rides and how convenient it is. So I want to shout out as well, coordinator, thank you so much for the hard work you do to make sure that ride gets completed. So Rachel, on your side, is your story similar? Tell us about how operationally it's worked inside your clinic. Is it similar? Is it different? Tell us about it.
Yeah, so we definitely had a bit of a learning curve once we switched to primarily using our Uber rides for our volunteer staff member, because she was coordinating her own rides. She had her own Uber login, so it was really hands off on my part once we got her set up. But when we switched to getting patients in the Ubers, that took a lot more coordination within our clinic. So I'm actually the one who's scheduling all of our Ubers for our clinic, but we really had to think of some sort of system of how to communicate and relay the message and make sure all of the information got to me. And we were actually able to do that through integration in our EMR. And so all of that, like if you go into a patient's chart, you can see all of the messages for, patient needed an Uber on this day for this reason, like here's their address, here's their phone number. And so all of that information is also documented, just so we make sure we don't lose anyone. So that's definitely been kind of a challenge, but also just a really awesome way of seeing ways that we can integrate the Uber Health into our systems that we already have in place.
So it sounds like the rides have kind of become a fundamental part of your system there. And what I've heard as well is when an individual gets documented, they've taken some rides, you can actually schedule rides in advance. So it also has encouraged what I've heard repeat, certain appointments. Hey, you're here for this appointment. Maybe we can schedule you out and we can schedule the ride for you. Is that something you've all been doing as well?
Yes, absolutely. So when our patients are checking out at the front desk, they see that patient has taken an Uber that day, seeing that they need an Uber back home, and they're already going ahead and prompting the patient, hey, do you need a ride for this next appointment that we're scheduling with you? And that has just tremendously decreased our no-show rate and our patients' missed appointments. It's kept patients, on their medications because they're following up with their doctors regularly, and it's just been really great opportunity for our patients.
Amazing. Yolanda, what about the impact at your clinic? We've talked a little bit about how it worked, but what have you seen a little bit of the impact of the rides at your charitable pharmacy?
I think just being able to offer a ride has just been reassuring for both the patients as well as our staff, because there were some patients that we had, even with like medications, they would just stay on the shelf for week after week. And it was really a transportation issue. So being able to offer a ride for the patient was just really a game changer. And again, being able to offer additional services, getting them to their doctor's appointments and other things, it just really it was like a positive effect multiplier, because it opened up so many other doors. But I would say that we did have some challenges with some patients not really still trusting the system, but being able to offer the opportunity for them to bring a family member along with, sometimes really did provide a lot of comfort to patients. But we've really learned a lot throughout this process.
Yeah. So one of the things that I've heard clinics starting to experiment with, and we're looking for too, is actually having the clinic order rides to other locations, not only to the clinic itself, but to a supermarket if they live in the food desert, or to a specialist appointment, or to a special, screening, or community event even. So yeah, I love to hear all the different diverse dynamic ways that the clinic's been using the ride. So I got one more question before we end here is, as we continue with you into the future and we go beyond just COVID rides into other health access areas, do you have any hopes or any ideas or any dreams of how we might use these rides into the future? Or any hopes or aspirations you have moving forward as we look to continue these rides with you? So Rachel, I'll go to you first, and then Yolanda, you can close this out. Rachel, any hopes, desires, dreams for how we might use the rides in the future? Rachel?
Yeah, absolutely. So I guess I'll share this like little inspirational story that's going to be kind of ongoing for the foreseeable future. So as we got information that we were going to be able to really expand the Uber rides for different specialist appointments and things, we actually had a patient in our clinic who was diagnosed with cancer and was going to need to go through chemotherapy. And the patient is from Afghanistan. He does not speak any English. And so our two options were finding him reliable transportation to get back and forth to his chemo 3 times a week, or he would have to be hospitalized to do inpatient chemotherapy, which would be 45 minutes away from his home. And so we were able to very quickly say, yes, we will provide transportation. We will make sure he gets there and get him back and forth, because we don't want him to be separated from his family. We don't want him to be away from the food that he knows. We don't want him to be away from people who know his language, because we know those things affect health outcomes tremendously. And we know that these were the things that were going to help him while he was going through chemotherapy. So he's doing wonderfully, and we're just really, really thankful for Sostento and Uber Health.
Well, thank you, Rich. That is an inspirational story. That's going to be my grateful, I think, for the day to hear how you're using those rides already as we've expanded into those new ways. So Yolanda, what about you? What are you dreaming up? What do you think you'll be using the rides for next? Anything you want to share with us as we close out?
Well, I think, we've already started doing that, the food pantry, and then also being able to get folks to and from provider appointments. That's been really beneficial. But we also are hoping to do classes, like educational classes on diabetes and even point of care testing for certain disease states. So being able to offer additional rides for those additional services is going to be really critical in getting, an expanded health outcome, as well as just expanding and strengthening our relationships with the patients and the providers that we're working with.
Thank you, Yolanda. We often hear that word wraparound care. It's easier said than done, but it sounds like you'll be using those rides for education, for all kinds of appointments to make sure those individuals are getting wraparound care. So I want to thank you, Rachel. Thank you, Yolanda, for spending some time with us, for continuing to do the rides. We're going to keep doing it through the end of 2023 and beyond. And thank you for sharing your inspirational stories with our network today. We'll look forward to keep telling those stories out as you have them come in. So thank you so much. Have a wonderful afternoon. And thank you for spending some time from your clinic day with us.
Thank you so much for your support. Yes, we appreciate everything that you've done for us.
Cheers.
Thank you.
All right. Well, there we go. Another Sostento Live with no technical issues. I can't believe it. We've done, I think, about 10 of these almost, and never once had anyone drop off or any tech issues. So I'm going to be grateful for that as well today. As mentioned earlier, we are going to be continuing our ride service. We are looking to expand it and continue it into the future. So stay tuned to learn more about how we're looking to expand our ride service. If you're a free and charitable clinic out there, we are working to bring that to you. So stay tuned. We'll be working with the state associations of free and charitable clinics as well to think about how we can expand this, working with Uber, working with Lyft, working with all partners that are willing to help expand this game-changing service. Now, in terms of Sostento Live, Sostento is going on summer break, so we will be having no live events in July or August, but stay tuned. We are planning to come back in the fall with more live events, with more uplifting, inspirational stories, more best practices from across our network. So be on the lookout. We'll send you a recording of today's event, and when we get our next live event scheduled, we will let you know. So I want to thank everyone for tuning in today, and I hope to see you at the next one. Take care.